Hello, everybody. I think we have a few more people to uh, join, and so we'll wait just a couple of minutes. Okay. I think let's go ahead and get started. I see that I think Danielle Ayers is here. We're going to start with her presentation. She's going to be talking to us about the new MIECHV National Outcomes Dashboard. And so, Danielle, are you here?
I'm here, yes.
Oh, okay, great. I'll stop sharing and uh, you can take it away.
All righty. Okay, can you guys see the screen?
Yes.
Perfect. I'm going to go ahead and put this link in the chat as well, so you will have it. You want to pull it up at some point, but this is open to the public, so anybody would have access to this. This dashboard is new to us, and it was a requirement of the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022. Some states were not as excited about having a dashboard that was open to the public because of funding. Somebody might think one program's doing better than the other, and maybe funding could be threatened. But alas, it is here and has some really good information that I'm excited to share with you guys today. So this data, as it is new, is from the fiscal year 24. So this, I'm going to really only show you Oklahoma's, but if you are interested in other states, you are welcome to look at any of the others on this dashboard as well. There are some resource guides over here. If you were interested in downloading them, there's some export. You can export the entire dashboard if that's of interest to you, as well as a guide. So some things I want to point out, anything with a green check mark means we're doing really good. This indicates Oklahoma's performance was equal or better than the national average. So those are really great things that we want to see. I'm going to point some text to you here. The text in orange is that MIECHV average across the nation of other MIECHV sites. So we have here the Form 2, we have 19 benchmarks. And again, this is from fiscal year 24. We are expected to make some changes to the benchmarks in the future. Those changes have not been finalized, but there is a discussion going on right now. So we can see we're doing pretty well with preterm birth and breastfeeding, as well as well child visits. And I should point out here that Oklahoma our percentage is in this bold black font, these numbers here. And we can just go around here. We see doing pretty good with tobacco cessation referrals. And so we've had quite a bit of discussion about some of these benchmarks, ones that we really want to work towards improving. And one of those I want to point out is the early language and literacy activities. This is anybody who has read or told a story. It could be a family member, it could be the primary caregiver to a child every day for a week. And we have consistently fallen pretty low amongst that national average. And so continuing discussions about what we can do to really get those numbers up. So all 19, I'm sorry, with the exception of 18 of the benchmarks are collected through ETO. There is benchmark for child maltreatment that we get from Department of Human Services. But everything else is through ETO. And this probably won't surprise you here that a couple of our referrals aren't doing very great. I know we've had continued discussions about how to perhaps improve that referral tracking touch point, as this is where we gather that data from, and that's reflected here in these benchmarks. Go back up here. Sorry, don't want to make anybody have motion sickness. I hate scrolling like this. And I'm sharing, but I did want to go back up here and point out a couple more things. If we go over here to the awardee profile, you have some other options. I don't think it did that actually. There. Yeah, I'm going to change it. It defaults back to Alabama since that's alphabetically the first state. Change it back to Oklahoma. And this is another overview of additional information. And so you can see what the base award is, how much was matched, how many home visiting staff we have that are full-time, and the total number of LIAs, caseloads, home visits, in-person visits versus virtual visits, and how many households were served. We have this nice map that shows the 3 counties where MIECHV funding is serving clients. And then over here, we have a MIECHV needs assessment. This is from the 2020 needs assessment that was done in Oklahoma. And as you scroll down, we're going to start to see that data that is collected for the Form 1. So all the benchmarks that were shared previously are on Form 2. Form 1 has demographic information primarily, and then some other characteristics of the clients that are served. So here we have a few questions that are considered pretty sensitive. I know sometimes there's hesitation to ask about the history of child abuse or neglect, or history of substance use or tobacco cessation, which is, or use, excuse me, in the home. But we can see here that this is pretty important, and to ask these questions, and then we can see it reflected here on this shared dashboard. And then if you skip all the way, and you're welcome to look at that detailed view of those benchmarks if you want. I've skipped that tab, but you're welcome to look at that. That's interesting to you. But at the end, we have the demonstration of improvement, and you can see if we met our requirements for that year. And so for the demonstration, you might notice this is fiscal year 23. For the demonstration of improvement, we consider where we were the previous year and where we're at now. And those two things together would determine whether or not we have made or demonstrated improvement. And this last tab up here is just the home visiting models, and you can see kind of what's going on here. We can just click on Oklahoma, or you can click on another state if you're interested. And that's pretty much it. Can I answer any questions about this?
I'm just surprised how low in referrals for depression and the developmental for children, because we have been so diligent on really paying attention, and every person that's the scores high in depression are referred, not necessarily, they get into services, but this is more referrals. Now there's less and less places to refer families, but referrals are down 100%, and the same with the developmental. So I wonder why we're so low in those benchmarks.
Well, there's two things with both of those benchmarks. So with the depression, we did make a change last year so that we added on that screener, were you referred for services, and that should be sufficient for that numerator on that particular benchmark. So I do expect to see an improvement there, because if you just selected yes, then we can say yes, they were referred. So it's kind of bypassing that referral tracking. For the developmental referrals, there are some time elements there. So the child had to also receive services. They were referred and received an evaluation within 45 days. And so that is probably contributing to that lower percentage.
Yeah, that's what it is. Okay. I see that. Okay.
Yeah, this is Yolanda with OKCPS PAT, but I'm like Patty, I was kind of surprised about those numbers. One of the things that I would like to see, and I know that we talk about referral tracking several times during these calls, because I think also, when I read the documentation in files review, I can see a lot of referrals, and but sometimes the educators don't put the referral tracking, which I mean it is because they're time consuming and they forget and things like that. So I wish that referral tracking the way it is, and it can maybe change for maybe built into the documentation, and also I think sometimes you enter the referral, you leave it open, maybe waiting to resolve. And maybe if the family don't, if you refer, for example, we're talking about depression, if the family doesn't take initiative to go wherever the educator has been referred, maybe that referral stay open. And I mean, I know it is try when you're dealing with 20 plus families and do referrals in a monthly basis, but I really was surprised, because I know that for depression, we also have an outcome with the PAT, and I look those every year very, very close, because we had to report those numbers. So I was like Patty, kind of surprised about it.
Yes, yes, I think that we can agree that we need to do some work with that referral tracking. And I'm encouraged by a lot of the discussions going on right now, but I certainly acknowledge what you say, Yolanda, and can reaffirm that we've got some work to do there.
I guess also can be brought up. I didn't know that in order for to count for the developmental, that if they were referred, because many times they are in waiting list for the longest time, or they call them and they haven't done the screening, or I mean the evaluation, that people knows that if within 45 days, then it's not going to count. Because that can make a huge difference. But sometimes you're tied, and that because you've done what you need to do, the referral, but then getting that to, an actual
Sure.
evaluation, it's not even in your hands. And I know that for um, autistic children, a possible, diagnosed with that, it could take you a year to get a child into that. I mean, it's just very difficult sometimes, the connection. Or you do that referral and it's just, I don't know, logistics or whatever the reason of the family is not answering the phone, or the changing the appointments that to do it within 45 days. Um, we might end up like that. I don't think you'll improve that much in that one.
Yeah, and we certainly don't have a lot of control. HRSA has created these particular measures, and this, they've defined the numerator and the denominator, and we have to work within their guidelines. But we are working to create a better guide to share with you guys exactly how this is collected in ETO. And this is under review right now, so I don't want to show you like the entire document, but I can show you an example if it would be helpful to see the direction we're going into so that you also can see how and where we're collecting this. So let me go ahead and just give you an example. All right, can you now see kind of this table here instead of that HRSA dashboard? So this is the direction we're going to be going into, and this will be shared with you again when this is final. Again, it's being reviewed with HRSA right now. But it's going to show you exactly what we're looking for, those definitions, and how we're collecting it in ETO, exactly which form, because it can be confusing for you guys as well, because we do ask some of the same questions on different touch points, and you may not be clear exactly which one we're pulling for that benchmark data. And so I think this will really be helpful going forward as well.
That would be
All right, any other questions? All right, thank you very much, Danielle. That was really interesting.
Lisa, I have a quick question.
Oh,
I'm
sure, go
sorry.
ahead.
Do we
You're
kind of
all
have a timeline on that form that she's working on, like anticipated timeline for that to be shared?
Yes, by October 1st.
Awesome.
We're
Thank you.
actively meeting with them, and it's under review, and we're meeting on early next week to go over some of their comments. So it'll be coming very soon, Stacy.
Awesome. Thank you.
You're welcome.
Have another question, and I don't know that's going to be possible. I put things in my wish list, so but is any way I know that we have some in ETO some alerts for parent educators when forms are due. But for example, can we as supervisors have an alert if referrals they're open? And I just want to make sure that some of the referrals that we have open, if we have an answer and we kind of forget to go back and put it, I don't know that's going to be possible. I'm going to leave it in there. I don't know how ETO works, but maybe that'd be helpful. I don't know.
Yes, it's funny you should say that. We actually met with Bonterra, who owns ETO, yesterday, and that was brought up as a wish for us to have as well. Some of the alert functionality isn't where we would like it to be in ETO, especially when we're going based on a time. Like if this was taken at this time, can supervisors and home visitors get an alert 45 days since, for example, the developmental referral and services. And right now, it doesn't look like we have that functionality, but we are asking for it, and we'll see about that discussion. There's always the option of having a report. We can always build that in a report, and you could run it and see, who had not either updated that referral tracking or updated, to say that they had received services or what. So we always have that functionality in a report. A little problematic there with the alerts, but ongoing discussions about that.
All right. Thank you very much. Appreciate it, Danielle. Now I'd like to turn to our last two programs that haven't talked about their PDSA yet. And so I'd like to turn to Natalia from Parent Promise. And by the way, if you see me suddenly leap up from my chair, it's because I have my lunch in the oven and the alarm's going to go off in about 7 minutes. So.
Okay, yeah, we don't want you to burn your lunch, Lisa. Okay, hello everybody. Yes, my name is Natalia. I'm with Parent Promise. We're in Oklahoma City. We cover all of Oklahoma County. For our PDSA, we have two SMART aims. Our first one is to identify at least 3 forms that have items duplicated from other forms. I know that there are other sites who are also doing this, so we're really curious to see what everybody is working on and what they've gathered so far. So with that, we'll be looking at kind of forms that have to be completed and entered manually, where the information is being repeated on multiple forms and the PEs are having to ask kind of very similar questions more than once. And then for our SMART Aim 2, we're looking at reducing average frustration by at least 10% from our full-time PEs who are utilizing ETO. And we're doing that by just having them fill out very simple surveys. It's our data is going to be kind of interesting just in the sense that we didn't have a full team and now we have a full team. And so we started with a pre-survey to kind of see where their frustration level was at. And I was very surprised because when we got the data back to us, it wasn't very high. It was at like 2.8 or something like that. But one of our PEs was brand new and wasn't very frustrated with ETO at the time, and also barely getting a caseload started. So we've done a second survey now to kind of do like a mid and see if that's changed, and just asking different questions about their frustration level, like utilizing ETO, like how user-friendly it is, things like that. And then at the end, obviously there'll be a post survey. So we're curious to see how that's changed now that we actually have 2 brand new PEs who are newbies and are now, doing documentation and screenings and getting through the first foundational 8 and all that kind of stuff. So now they're getting a lot of practice with ETO. So we definitely expect that data to look different as we get the mid-survey results back and then of course the end, but we're just kind of tracking that to see where their frustration level is at. I know with all the different changes that are being implemented in ETO with the different screenings and stuff like that, we're curious to see if that makes a difference as well. And some of them are still getting kind of used to just the different changes and stuff. So whether we're going to get positive or negative comments and stuff. We're just curious. We're curious to see what it says. We definitely want to reduce burnout, and turnover, is an issue, I think, that everybody feels in this field. So we're definitely trying to reduce that and seeing how we can maintain frustration. There are certain things that are out of our control, but hopefully if we can make some really positive changes, it'll just make life simpler for everybody. But that's kind of where we're at for right now. We're waiting on the results for the mid-survey. So yeah, that's all that I have for now, Lisa.
Great. Thank you so much, Natalia. Now let's turn to Yolanda from Oklahoma City Public Schools, and she's going to be talking about a similar project.
Yeah, in matter of fact, thank you everybody. And like I said again, I'm the program supervisor for the PAT. And one of the things that we kind of look at ETO, and after talking to the team, not only in the staff meeting, but also reflective supervision. It was, the time consuming to do the paperwork, have to go, to 3 or 4 different forms to collect the information. And that was one of the main concerns that they have. And I think one phrase kind of, when one of my parent educators, or a couple of them, say, I don't mind so much about, do the visits and interact with the families, is the paperwork after that. Especially now that we have a lot of families in crisis. And so it was kind of the point that we're like, okay, maybe we need to be working, minimize the time that we spend doing paperwork. And we know for sure, I mean, that we had to get all these data, but we would try to find a way that is no overwhelm, especially for new parent educators. I mean, when you getting into ETO and start taking, well, we had to do an encounter, we had to do the documentation, we had to do goals, and so it can be overwhelmed. We have done a survey, and the parent educators do the survey monthly. And also I'm tracking some information about how many days off the educators take every month. So we're going to have those as outcome measure and process measures again. We went ahead already identified some forms that we like, again, talking about wish list before. And the camps, like I said, what you have to be doing different forms. So we were asked to do an encounter in a PAT, in this case, documentation. I know other programs use another form of documentation, but instead, we 2 different touch points can be only one touch point with different tabs. That was one of the things that we were asking. And the same thing with the goals review. We know that we have to set goal with family, but again, if there is somehow that one of the questions in our form is if the family has, or the educator have reviewed the goals, immediately we can go to that click and said, what is the goal that you're working with the family, so you don't have to be exiting that particular touch points.
Now, don't get too far into your results, Yolanda,
Sorry.
because you've got to do a presentation at the next learning session. So that gives us an idea of what you're doing. Thank you so much.
Okay. All righty. Thank you for letting me know, Liz. Thank you.
Okay, thank you. All right, let's do a quick survey about CSER. So if you'll hop on to this survey, has it popped up on your screen? And just answer these questions. If you answer yes to the first one, go to the second one. And if you answer no to the first one, you can skip the second one. And I'm going to go get my lunch. Okay, thank you. It looks like we have 9 of 15 saying yes, 2 saying no, 4 saying I don't know. And how many people have signed up? I can't tell. Thought that was supposed to be a short answer filling in. Oh well. Anyway, I'm glad to see that. I just was curious, and so I wanted to ask about it. Next, we'd like to hear from Dr. Fleming with an update on a couple of things that have been going on. So I'd like to turn that over to Tabitha, and I'm going to go off camera and eat a little bit.
Hey everyone, can you hear me okay?
Yes.
I'm being a little bit tech creative. I'm on two different devices, so apologies for confusion, but I'm at a conference and had to find a little place to be able to join the call. But I'm excited to be with you. I wanted just to give some brief updates on the MIECHV 10 projects that are currently still being collected. I do have some slides I'm going to share, so I will get those on the screen. And we'll get started. Right. Not able to use presenter mode, so apologies. It's not gonna, you'll have to deal with the PowerPoint. Okay, so these are just current updates on our projects. We have the Health Access Technology Survey, as well as the Parenting App Survey. We are right here at the tail end of August, and these two projects will continue to be collected through September, just to give everybody a timeline. So first, with the Health Access and Technology Survey, we want to just confirm with all, as we've talked about in the last few monthly calls, our bilingual research technician is actively recruiting Spanish-speaking families. These are coming from families who were engaged in all three of our models of home visiting, as well as families who are recipients of WIC, who are not ever currently or have ever been with home visiting. She's completed 10 so far. Our goal is to continue recruitment up till the end of September, so their voices can also be included. As a very brief reminder for what we're asking about with regard to health access, we're getting a sense of families' location, kind of their neighborhood and community, to think about what physical resources they can access close to home, their comfort discussing questions and concerns with their provider, the cultural competence of their provider, and for those who have done home visiting, more about their engagement in it, such as why they enrolled and what their experience had been. And then possible experiences of discrimination based off a variety of family characteristics across settings, so including home visiting, but as well as in other health service locations families might engage in. And then in addition to the presence of those potential experiences, also the frequency of discriminating experiences. For technology, we're asking about different areas where they might get advice about parenting. Some of that can be from other folks like a provider or doctor, as well as how much they might use online resources like the general internet or social media. We're also asking about their frequency of using online resources for parenting, how they feel toward using technology for parenting support, and how willing they would be to use a parenting app. I shared some of the preliminary results for this HATS survey when we met at the last learning session, and my hope is that we'll be able to share even more with you at the next. The parenting app study, I think we've mentioned briefly before, but to give you a closer look at what we're doing here, we acknowledge that parents are relying on digital resources more and more for information about development for their child, as well as how to parent. And it's really crucial for us to help connect parents to accurate information. especially knowing there's so much misinformation out there. And when we have access to accurate information, research shows that can reduce the risk of ineffective parenting practices and in turn reduce the risk of child maltreatment occurring. So because of that, we know it's key to kind of understand where parents are looking and what they're looking at when they have these digital resources. So the whole goal of the study is so that we can better understand parent perceptions of digital parenting resources to inform their necessity. Is this a good way for us to reach parents? Acceptability, do they like this? And how feasible is it to utilize online digital resources? So we right now are currently recruiting. Again, this will also be through this next month to the end of September. We are recruiting a smaller pool of folks because we'll actually use this as pilot data for a larger study. So we're aiming to meet with at least 20 people is the goal. For this project, they must have a child between the ages of 2 and 5 years of age. I'll talk about why that is here in a moment. They must also have internet access and a web-enabled device. So we're asking families to engage with a digital resource called Vroom. If you've not heard of it before, this is a free resource. It's available as a website as well as a mobile app that's freely accessible on all Android and iOS devices. All the features of Vroom are available in English and Spanish. And then select materials within this resource are available in over 15 languages. What it houses is 1,000 parenting tips, or they call them Vroom tips. So it's kind of just soundbite information about best practices in supporting young children. And the user can tailor what types of tips they see based off their child's age, so they can make profiles for their kiddos. So for this project, what we're doing is we're meeting with families and having them do what we're calling a pre-engagement survey. So meaning before they use Vroom. So we are learning about a few things, but we'll tell you about that. So they're completing the survey. Then they're going to be randomized like a flip of a coin to either use the website version or the mobile app version of Vroom. And then they're given instructions on how to do that and what we're asking them to do. Then over the next week, depending on which condition they receive, the website or the app, we're asking them to use it for that week about 5 minutes a day. After that 1 week of using or engaging in the resource, they're getting scheduled for a follow-up. And we're doing what we're calling a post-engagement or post-using Vroom survey, where we'll check in on how utilizing that resource may have impacted their parenting. And we're also doing individual qualitative interviews to get their feedback on what the resource was like and what they think about using something like this to help with parenting. On that pre and post engagement survey, some of the things we're asking about, we are again interested in their sources of parenting advice. So you saw that on the HAT study, we're doing that here as well. We're also asking about the frequency of different types of positive parenting behaviors they might have engaged in the past week, and seeing if that might be impacted by using Vroom, as well as their desire to change how much they are engaging in those activities. So just some examples of those, we're asking about activities that relate to supporting your child or enjoying them, like singing together, planning ahead as a parent, like warning your kid when there's a change in activity, and using limit setting. So for example, sticking to rules that you set. And then when we're asking them about the Vroom resource, we are trying to learn about how engaging they found it to be, if it was functional, if it worked well for them, what they thought of the look of it or the aesthetics, and how they would view that information and the impact it had on them. So looking ahead, as I mentioned, these results are meant to be leveraged to inform a large-scale multi-state study. Dr. Bard has some colleagues in other areas of the country who are actively working together to do this at a larger scale. And for that larger project, we'll consider where the resource is implemented. So if it's delivered through home visitors, or if it's happening in a primary care setting. And we'll also explore potential differences for groups of users. So depending on where they are found, maybe what language they speak, how many children they have, things like that. So those are the updates of our 2 current projects. Again, it's 1 month left, but if you have any questions, comments, or concerns, please feel free to ask.
Questions for Tabitha?
And again, apologies for the background noise from where I'm at, but I'm glad I got to still join you all for the monthly call.
Thank you, Tabitha. And the noise was not too distracting, so that worked out just great. Thank you. All right, now I'd like to turn it over to Dr. Bard for talking about some things about our evaluation plan and how it's running parallel to our CQI work, and to give you kind of an oversight, a bird's eye view of what we're planning.
Yeah, thanks, Lisa. So as promised, we want to revisit periodically the evaluation work that's happening in the same space in parallel with your CQI work. So I'm going to try to connect a few more of the dots that we've talked about in the past. And part of the reason for the timing today is that just less than a month ago, we had the evaluation plan for this work approved by our federal oversight officers, and we're moving forward to get IRB approval. Very soon, we will be collecting some of the data that I'm about to describe. All right, so I know we've covered the questions before. I'm going to go a layer deeper today, and we'll talk about some of the measures and some of the sub-aims, if you will, of the project on the whole. So the first aim is to identify and describe workforce support strategies used across Oklahoma's HVLIAs, those are your agencies, to promote professional well-being. So by now, I hope everybody's accustomed to our PWB acronym there. CSE, remember, is Coordinated State Evaluation. And HRSA turned over a new leaf in the last round of MIECHV funding. So this is now 4 years ago, almost 4 years ago. And rather than have each individual state or MIECHV awardee go off and pursue their own interests in research and evaluation, they're asking us to combine forces with other states and territories that have MIECHV funding and choose a common topic, work on it together. So we are now part of what's called Cohort 2, Workforce Development. And this is our Oklahoma evaluation plan, of which several elements overlap with other states working on the same topic. Question number 1, point 1 here is that what organizational policies, supervisory practices, and system level supports are currently in place to promote professional well-being among home visiting staff. So I'll show you in a second how we hope to gather information on that. The second question is which workforce supports are perceived by staff and supervisors as most effective in enhancing professional well-being? And then lastly, how do the availability and implementation of workforce supports vary by program model, region, or agency characteristics? So I know that's a mouthful. How are we going to gather information on these topics? For this particular aim, it's largely qualitative data. And we're going to use 2 approaches broadly. The first of which is a new leaf for us. And I may have promoted it, or we may have promoted it previously, but I don't think we've talked about it in depth yet, that we're hoping to use photo voice in this next year to gather information on this AIM 1 topic. So what is photo voice? Well, as the name would imply, it involves taking photos. And we're hoping that this is an engaging exercise that also provides sort of new insight, new depth of discovery for, in this case, the topic of professional well-being. We want you, I'll play Uncle Sam here. We want your input, right? And we will be contacting all of your staff to provide photos on this topic of professional well-being. What you can expect, pending IRB approval here, is a request from us with guidance about the number of photos we'd like each individual to submit, the method of being able to submit that securely to our group, some basic guardrails here are the types of things we hope that you include in those photos. and things that we would prefer you not. So for instance, we would prefer to not have any photographs of a client's home or belongings or the like, right? But if you have a similar item at home or in the office or elsewhere that is not identifying to your clients, but reminds you of a topic related to professional well-being, those are fair game. So we will have examples, and we'll spend a lot of time in the next learning session walking through those guardrails and the submission process. But again, just forecasting here of what's to come. This is a year one, aim one objective. So this is where we want to hit the ground running. We will fall back on our traditional qualitative approach as well with the interviews. Here we will be recruiting a subset of you to participate as providers or supervisors, and even our agency and state level administrators. We hope to get insight from all of those groups as we have done traditionally in the past. Surveys at the end of this coming federal fiscal year, which doesn't actually kick off right for one more month, but this is on our calendar. We will have our first quantitative assessment, and it will be a survey of providers and supervisors all about, well, not all about, but primarily about this AIM 1 topic of supports that are in place today to promote professional well-being. There'll be follow-up questions about how effective are those supports, and some follow-up questions about what supports do not exist that in an ideal world would be great to have. AIM 2 picks up where AIM 1 leaves off, and there's a little bit of overlap. We're going to work on both of these simultaneously for the end of next year, but then the year after that, we will sort of shift gears and mostly be focused on this topic, examine associations between these workforce supports and professional well-being among home visiting staff. So first year is largely exploratory. What are these supports? Where do they exist? Do they differ across agencies? The second year is, how strongly are these things associated with professional well-being? They may be well-intentioned and intuitively be linked to one another, but we want some data to back it up. So we'll be collecting some data to look at that association. Sub-questions here, we're looking at workforce supports and how they are associated with specific types of professional well-being. So general types, and then what we call domain-specific well-being topics like emotional exhaustion, work-life balance, stress, role clarity. The second question under this thing is about workforce supports and which ones are most strongly associated with staff retention and burnout. We will have some questions about that in the survey that I mentioned at the end of year one. But we will also be looking at administrative data as a complementary output here, particularly for staff retention. So how long are people staying with their programs, and is that associated in any way with the supports that existed for that agency? Is it associated with their self-reported professional well-being if we were lucky enough to get them to fill out that year one survey? Third question under this AIM is, are associations between workforce supports and well-being moderated by individual or organizational factors? So it's highly likely that these associations are context dependent, so we want to explore those contexts. Lastly, and this is where there's a lot of overlap with what we're doing with the CQI network, we'll be looking at system level enhancements and how these may be affecting professional well-being, retention outcomes, perception of supports. In terms of methodology, this is a mixture of qualitative and quantitative. It'll be more quantitative on the front end than certainly AIM 1. We will reuse some of the responses we get from that survey at the end of year one, and then be collecting some periodic updates of professional well-being. That third question that I mentioned previously, we're going to link survey responses to some longitudinal administrative data. Looking at staff retention, we'll also examine these context-dependent changes in the association over time. This is really question 2.2 and 2.3. Sorry, there's a typo here. And then lastly is the, we call it quasi-experimental design. So what you're doing, I think we view as quasi-experimental. We're not randomly assigning people to conditions per se, but we're certainly manipulating things. And there's some really compelling before and after that we want to examine here. What does professional well-being look like, or you tell us might have looked like prior to your involvement with the Learning Collaborative and all of the change ideas that you're implementing? So a few key examples are listed here, but we're interested in all of those change ideas. There will be some other surveys that are assessed. Some of those you will deliver yourself as part of your PDSA, and we will repurpose those responses here as new information to contribute to this coordinated state evaluation on workforce development. The third and final aim of this, what will become, or what is, I should say, a 4-year project. The first year is all planning, so we're just about wrapped up with that now. So 3 years of active data collection and analysis. Aim 3, which is largely going to happen in that final year, is to assess whether professional well-being and among home visiting staff influence client retention and engagement. So I know I've said this previously, that we're not abandoning this topic of family engagement, which has been our focus for what they now call cohort 1 of coordinated state evaluations, right? That's what we've been working on for the past 4 years for our MIECHV research and evaluation. Although we're transitioning to a focus on professional well-being, we're still interested in these tricky questions of how do we impact and what influences client enrollment and retention. So question 3.1, what extent are staff well-being indicators associated with client retention over time? Question 3.2, do higher levels of workforce well-being predict active involvement in programs? And then lastly, how do clients perceive the well-being or the demeanor of their provider? Are their perceptions related to their engagement and satisfaction? So the last one, we're really interested in whether or not your clients, or clients of your program, I should say, can perceive and predict accurately the self-reported well-being measures of the providers. This one's also mixed method. We, again, are going to look back at the survey responses from year 1, particularly those professional well-being reports from the providers, to see whether or not that predicts client retention in the 2 years that follow that administration. And then we'll also be looking at the alignment of those professional well-being responses to what the clients tell us their perceptions are of provider well-being. Qualitative interviews will be heavily used in this work as well. I think I've already said all that, sorry. A few of the specific measures, I'm not going to concentrate on those today. Timeline, a repeat of what I think I said as I was going through each of those aims. Year 1 is wrapping up now. We're in the process of getting IRB approval for all of the data collection that's planned. Year 2 will focus on aim 1. Year 3 will focus largely on aim 2, and year 4 will largely focus on aim 3. Lots of opportunities here for periodic reporting back. That'll happen in these monthly calls. That'll happen in our learning sessions. And likely towards the end of this 4-year period, there'll be other dissemination opportunities, both regionally and certainly nationally. And I'm going to end on that. I gave this talk last week, and Lisa thought it would be a nice contribution to today's discussion. We ended, I guess, that presentation a week ago, which was with our peer sites, all the other sites working on workforce development, asking some questions about what could we do better, or what should we be thinking about as we start to implement this plan. Most of the responses we got is about the question that I have highlighted here in the middle, and I'm definitely interested in hearing this group's take on how might we engage workers, particularly those that are high on burnout at present, or maybe we're high on burnout and thereby left the program, or therefore left the program. We want that voice represented, and recognize that could be a tricky group to contact and then be able to capture their sentiments. So if you have thoughts on that, I would love to entertain those now, or you can send us an email as always.
Yeah, in interest of time, I think we should go with sending emails. Were you going to also give any kind of overview, kind of that bird's eye view that we were talking about, or should I go ahead and proceed with the last item on our agenda?
that may be me misunderstanding what we meant by bird's eye view. So that's a bird's eye view, certainly, of the evaluation plan. How it connects to the CQI network is largely through that question 2.4, the quasi-experimental work that we'll be doing, evaluating your change ideas and the impact on professional well-being. That is, just FYI, one of the elements I think sort of sets our group apart from the rest of the states that are exploring this topic. Very few are trying to actually implement change ideas and test their impact on professional well-being.
Yeah, so what you're doing, it's not just what is happening with the well-being within your agency, but also we're collecting the data on professional well-being as we go along, and we can see how is that moving across the course of these 4 years. And so I just wanted you to have to know that we're really interested in what you're doing, not just within, but between and across all of the agencies. So I think it's been a really exciting project for us because we can tell how engaged all of you are. Is there anything you'd like to add to that, David?
Oh, just to say that it's not just our group that's interested in the findings from your PDSA. Right. So now the cat's out of the bag, and all these other states that are working on this topic know that in Oklahoma, this is happening. So they are very eager to see what you find out at the end of each one of your PDSA cycles.
Okay, thanks. I don't want us to run out of time. The last item is, instead of interrupting your life with an email to vote on the MIECHV call, I've dropped into the chat a link to the doodle poll. We would like everyone to go ahead and do that right now. We had some feedback from some of you saying that your schedules really fill up because you're so busy, and sometimes we are sending these polls too late in the month for you, and it's harder to schedule. So please vote on these times that we are available, and if you would do that right now, that would be a big help, and you'll get one fewer email from Lisa Tunley badgering you to complete the survey. And while everybody's doing that, does anybody else have anything else that they would like to discuss or bring up or ask David about? I can't show you my ridiculously cute new puppy. Come here, Jolly.
Yes, you definitely need to do that, Lisa. We've seen the photograph out, but the flesh and blood version is even better. I'll just comment that because it came up in some calls the last couple of weeks, but so everybody knows, the next learning session should be November. We're looking mid-November, hoping to dodge the holiday there. But bear that in mind, especially as you start to think about, Yolanda, your opportunity to actually share those results with everyone. So mid-November, next learning session.
Oh, David, just a quick question. Do you know if we're going to have it here in Oklahoma or?
It'll be in the state of Oklahoma. I think we're hoping to be as fair as possible and alternate locations. So I know we were in Tulsa last time. I guess that was Oklahoma City.
Okay, no, my question is, and I talked to Lisa the other day, I'm sorry. You know, we have a different procedure now to do with Oklahoma City Public Schools every time that we leave the metro. So if I know what time, I got time to get all the signatures that I need for me and my staff.
No, that's a good reminder to me. That's right. That came up last time too. So yes, we'll give you a formal date before the next call, and that way you can start to pursue those approvals.
Thank you.
Yeah, we'll need to start putting together a rough agenda so that Yolanda can submit that. She needs that for her request. Are we going to do it in person or are we going to do virtual?
In person, and if others on the call keep me honest here, I know we have a call set about the learning session in just a couple of weeks. So let's make sure we hammer out that agenda, and then we can circulate it right after that meeting.
Okay. We're finishing right on time, everybody. Thank you so much for your time, and I hope you all have a good afternoon.
Have a
Thank
great
you.
holiday.